iTherapy, for this one, it is a program. It's not a course. It is a program. I have this to study how it can help to emit qi 24 hours, 7 days a week, remotely. Meaning you need not have to be in front of me, right? You need not have to present personally. I do not have to do it 24 hours. So I depends on the system to do it. Now, how the system works, it is like, now that I'm sending qi, now we form qi field. When we form qi field, if I want to channel our energy and intention to a lake, this is a lake in Colorado, De La Marina, okay? So if I would send it, how can I locate that my information will go there? My intention, my qi field will be there. It is by the map and location, right? So if personally I want to go there, it is also depends on the location and the map, then I'll be there. Now, when we do this kind of qi healing class, we're actually not facing each other. We are a few thousand kilometers apart, a few thousand miles apart. So this is done remotely as well. Our intention, our qi, it is not bound or limited by space, by time. It can travel anywhere I want. I can go to the universe now with my mind. As long as you know exactly how the universe is like, then you'll be there. I can go to New York by now with my mind because I've been there, right? So you know the location, you know the map of this. Now, how can qi go to a person then? How can I send it directly to you and not to your mother or parent or your children? Why I specifically can send it to you? Now, as a person, what we recognize it is by the face or the name. So the face is so much unique to yourself. Name is unique to yourself. So when I set up a program or a system, then I have to look at this group of people. So if this is a group of people, I pick up the information from this group and then I set up a program, which is the external qi healing program, to clear the blockages, to make the qi flow much better. So can I use this to others? Less effective because I pick up from this group. So I send it directly to this group. Now from the picture that you send, the one that facing me has more direct effect, right, than the one that turned to the other side. So if you were to send me a picture, make sure you send this one, the one with the mark, right? So how did we do that? We're actually similar thing as what we did in this session, the qi healing session. We are using extraordinary capability. So we were trained to pick up information like checking and scanning your qi using easy ability. So when we check, then we know that, oh, the brain is not clear yet. Well, your neck has a little bit blockage, right? So some blockage in the nerves, right? Even in a group, then we can pick it up one by one. So then we will use our ability to send the external qi to clear what we have picked up. So when we pick up, there is a block there. Qi flow is not good, so we have to clear that. Now, for this specific study, we're studying on external qi healing on central nervous system. So central nervous system, we focus on the brain and along the spine, nerves branch off from the spine, okay? Then what happened is that the information that we have and the intention, the qi itself, it convert into energy. Convert into energy into who? Into this group. of those I have the photo with. So this group of people I'll let you know how we set it up into a box which is concealed, so that that program itself, the external Qihealing, it is specific into this group, okay, to have a bigger effect onto this group. So there is no side effect because there is not, I did not poke a needle onto you, not even in your photo, right? So there is no touching, no massaging, no nothing tweaking, but it is purely the external Qi, okay? No side effect on that. Now, for some of those who are sensitive, without Qigong experience, I just received a feedback 2 days ago. A lady who was very anxious all the time and sick for help. I set it up on that day when I set up the program in this system, and she said that, whoa, I could feel it, even though you did not see it, you cannot touch it, but I could feel that my state become happier throughout the day, and then I get calmer, right? So this is the effect. Sometimes it will depend. It will depend whether the effect it is immediate or it needs time, especially those who have physical sickness or you have physical injury that will take longer time, right? Longer time. I had one run on my grandmother. She fell down and the bone broken down into tiny lines, okay, fractured at the hip girdle there. So at the age of 85, it was kind of difficult for the doctor to do anything else. So they can't really open it up and fix it. So what I did is that I did not have any expectation. So what I did is that I set up the program just to help. I'm not too sure what will be the result. So 7 days after, she could walk. And people thought that, hey, the doctor said, with this kind of fracture, it's impossible for you to walk. And she said, yeah, because there's no pain. There's no pain at all. So it is not because of the painkiller or whatever, but it's also because of the external Qihealing. It is doing a little bit more effect on that. Okay, so this is some of the sharing. But still, we cannot promise anything because this is the first time we are doing on the central nervous system. Especially those who have this kind of nervous system, which prolong for a long period of time. So we will try it out because you will have 2 weeks of trial. Now this is from my office. What we did is that we set up the system and the file using our computer, and then we store it into a system where this system, it is individually playback in the box. So the box is nothing specific, normal box, but we want to contain the external Qihealing information into that specific group or person. Over the past, we did it one by one. It's very, very time consuming, right? We need effort to change everything. So now this is the first time, or we should say will be the second time. The first time we have this on the ALS group. Remember, Kelly, when we set up in September? So we have 5 into the group. So we run it frequently. And we got a feedback and our update the file, the external Qihealing file. So why I should always update the file is because we are human. We have different conditions, and our Qi condition in our body, in our mind, change frequently. Agree? So sometimes the weather change, your Qi condition change. Sometimes you did something hard work and you stress up, Qi condition change. So the external Qihealing file, it has to be updated from time to time. Normally, what from our experience is that over 3 months, then it will get stabilized. Then the program will help to maintain it better. And that was why there are lots of monitoring in progress. we need your feedback. All these files currently are still running. Some have been running for more than 1 year, 1 year, more than 3 years, especially those children, children with special needs. Yeah, it may take longer time for them. Some of them, they have been running for 4 years, since 2016 till now. The parents observe that they are progressing well. And some, they even have revealed their inner potential. Like some mathematics was superb, being very smart. Some smart in mechanical stuff, right? So this is one of it. It has been reported in the local dailies, the local papers, 3 of them. But most of them, or all of them, were in Chinese, right? Then Wei Lao Shi converted or translated it into English. Currently in Malaysia, both of us are doing this one, right? But somehow it is very difficult for us to promote because most people, they don't really understand what is external Qihealing. So I receive a lot of call, but people just can't really understand it, right? Okay. Now, how to apply into this program? It's only for those interested, and if you need it, because we are specifically onto central nervous system. You can send me an email with a recent photo. Remember, the photo is that you have to face me directly, yeah, face to the front, half body size, yeah, like this one. That is good enough. Let me know your background, health concerns, your country and state, right? Sometimes I have to write it down. Remember, I need to direct the system and program directly to you in a specific group. So your name and also your picture means it a lot. We'll assess and review if you're qualified. As I said, it is in a group, so I need to categorize it, right? So that I can build a external Qihealing specifically for that Qi condition. So I have to group it and categorize it. It has to be related to central nervous system. I'll notify you once you are accepted. We'll start 2 weeks trial program. As I said, not everyone can accept this, right? You can try it out, and for those who are sensitive, you'll be able to feel a little bit changes, kind of like energy flow, and throughout the days, you feel your state of mind is kind of different. So you tried it out. We can't really guarantee everyone will be able to feel it differently. Yeah. So for 2 weeks, we'll start on the 1st of April, and it will run until mid-April. Right? After 2 weeks, you can send me the report for your progress, and again, send me your latest photo. For us, we'll pick up the Qi condition and we'll compare before and after, whether there's any change on you. This will help me. This will help me, as this is a study, the first study that we have in group, big group. So I'll based on your feedback to fine tune the program. Even though you don't want to continue with the program, please do send me feedback, because this will help me to improve my skill to fine tune the program. It will help the other groups, right? Yeah, thank you. This is very important. Now, option is that after you have 2 weeks trial and you feel, I think something is changing on me. Yeah, I feel it. So you want to enroll, you can enroll to 1 month iTherapy program at $30 per month, right? $30 because this is in group, 6 in a group. So in the past, we run it for per person per program, which costs higher, yeah, 180. But for this group, we want to make it affordable for you to try it out. Yeah. Once you have confidence, then you can decide whether you want to go for personal. So we'll start the whole group, 6 person in a group in mid-April. So my purpose to study a program, it is to help. I saw some of people who are suffering pain throughout the days. So I think, why not I set up a program and I study it through, whether I can help use this system to help many more. because I will have one setup to help 6 persons in a group. So to help those who have prolonged symptoms to reduce pain, and also at least trying my best to do this, to reduce the deterioration rate. As we know, it's studied through, and Kelly provided me a lot of information about ALS. So the deterioration rate is pretty fast. So I try to study a program whether we can use this to reduce the deterioration rate. Not only this, Parkinsonism and dementia, Alzheimer's, all these, they will progressing very fast if we did not stop it, if we do not practice. So the best out of the best is to get well with your own practices. This is my wish, my dream. And hope it is our dream as well. Kelly's as well. Yeah, I know. Hopefully one day we can work it out to get well with your own practice. Now, with your own practice, you will also have to take care of your emotion. Do not get too much of stress. Stress will injure or further damage our nervous system. So try to relax, try to plan your schedule, not in a very tight schedule, right? Rest enough, then hopefully we'll get into this path. Get well with a system, with information therapy on top of your practices. So we could not guarantee the result, but I'll just try my best. So this is a program for those who are interested. If you're interested, then you can send an email to me. I can send the information out to Kelly and some of you. So if you were to have this information, you can type in your emails in the chat box, and then we can send it out to you as well. Okay, so they are not missed out from the information that we get. Do you have any question? You may ask question if you have.